Fungal infections are becoming very common.
Fungus tends to thrive on the hot, humid climate. As you can see in our country, there is a lot of overcrowding.
Can people repair this damaged skin barrier?
It is quite easy to repair the skin barrier damage by using gentle cleansers, moisturizers and sunscreen.
So what are the actual treatments available for hair fall?
There are many treatments which are available for hair loss. Most important of them is minoxidil.
Do we need sunscreen every day and especially indoors?
Sun causes a lot of damage on our skin. It causes premature aging.
People have this habit of popping their pimples, and these all usually lead to poor pigmentation and scarring.
Acne should never be touched or popped. In fact, there is a term given to this, which is known as acne scoring.
So what exactly is the skincare barrier?
We have the outer layer of skin, which is known as stratum corneum. Now, stratum corneum, consider this to be like a brick wall.
Are people unknowingly damaging the skin barriers nowadays? Welcome to the official podcast series by Lilavati Hospital and Research Center. Today, we are surrounded by skincare trends, miracle skincare products, and social media advices. It's becoming really challenging to know what is actually backed by real science. So, how do we understand what is good for our skin health, prevent diseases, and make informed choices about our skin? To answer all these questions, we are joined by Dr. Shrichand G, Parasramani, a well-known Indian dermatologist and laser surgeon with more than 35 years of experience. He is well reputed for his expertise in medical and cosmetic dermatology. He is always been on the forefront for helping patients in making their skin healthy with well-known renowned treatments and advanced skincare health. Thank you, Dr. Parasramani, for joining us. It's a pleasure to have you today.
Thank you very much. It's an honor to be over here.
Doctor, skincare advice is everywhere today with social media influencers with viral trending remedies. So what is actually effective for people out there regarding these remedies and what they should avoid it?
There are a lot of trends seen in the social media and not all of them are misplaced. Trends are very useful at times and at times they may even lead to undesired consequences. So we have to be very careful in following any particular trend. Suppose there's any ointment, cream or a serum which is trending on the social media. We should be very careful before starting this particular drug or a ointment. We should always try to verify and find out what are the constituents of this particular ointment, what are the actives, what is the percentage of actives, whether it will be useful for us, for the type of skin that we have got, acne-prone skin or dry skin or oily skin. And we have to be very careful before starting any particular cream or an ointment.
Doctor, definitely this is a way how we can verify the trends. How can our audience avoid these trends of following these viral remedies?
There are various methods by which we can avoid these trends. If we should, after knowing what are the constituents of a particular drug, we must find out whether the authorized sources or from where we have got this particular cream or an ointment, whether the regulatory bodies have really authorized this and it has passed a lot of all these tests. And then what are the adverse events, what is the efficacy of a particular drug. And we should be very careful before starting any particular new drug or a cream on our body. Because sometimes it can cause a reaction. So it's better to carry out a patch test, apply this cream or a serum or an ointment in a covered area of a body for 2-3 days and try to see whether does this give rise to any allergic reaction. And if it does, it is better to avoid. Never use any new product before any event such as a marriage or a social function or if you are going for an interview. Because if any disastrous consequence were to occur after local application, it will be very difficult to control it in a short period of time.
Doctor, that's an important message since in the coming age where any information is just a swipe away from us. Skincare barrier is becoming a very popular topic nowadays. So what exactly is the skincare barrier?
Now, skincare barrier is extremely important because this protects our skin from the harsh environment which is outside. Now, what are the cells which constitute the skin barrier? We have the outer layer of skin which is known as stratum corneum. Now, stratum corneum, consider this to be like a brick wall. So what happens in a brick wall? We have bricks which are attached to each other with mortar, which is the cement. Similarly, on the outer layer of our skin, we have stratum corneum. These are cells which resemble bricks. Mortar consists of ceramides, fatty acids, and cholesterol. So all this mortar holds the skin stratum corneum cells to each other so that we do not damage our skin. Now, how does the skin get damaged? From outside, pollutants, microbes can enter into our body, and this is then stopped by the stratum corneum cells. Similarly, there can be loss of water from inside the body. This leads to dehydration and skin will get dry. This is known as transepidermal water loss, and this can be avoided if the skin barrier is not affected, and skin barrier lastly keeps our body healthy.
Are people unknowingly damaging the skin barriers nowadays?
Yes, we tend to damage our skin barrier unknowingly because if you go out in the harsh sun, windy atmosphere, or then we have a dry climate, cold climate, which can damage our skin. And then rubbing our skin or using a loofahs and constantly applying harsh ointments and creams on the surface of our skin, we can damage our skin.
How can people repair this damaged skin barrier?
It is quite easy to repair the skin barrier damage by using gentle cleansers, moisturizers, and sunscreen, and give time for the skin barrier to get all right. It does take some time, may take a few months, but the skin definitely gets all right over a period of time. The body has a self-healing process.
Doctor, since we are on the topic of skin, acne was considered to be a teenage problem. But nowadays, people between the age of 20 and 30s are also suffering from it. So what are the reasons behind this?
Earlier in the past, we thought acne which starts at the teenage, when we are teenagers, and it comes when we become adolescent, acne would stop. But however, now we do understand acne is caused by hormones, and hormones do not stop when we become an adult. So in many people, although acne starts at the teenage level, it continues beyond adolescence and even into the adulthood. Many of the patients, they tend to have underlying hormonal problems. They may have PCOS or maybe on oral contraceptive pills, especially the females. They tend to develop acne. And use of makeup, especially the makeup which is very oily, which is very thick, it tends to cover the surface of our skin. Then acne can occur. And even diet has a very big role in the occurrence of acne. People have food fads, they tend to have oily food, sweet foods, or a lot of sugars, polyunsaturated fatty acids, then processed foods. So this leads to occurrence of acne. If we should eat healthy, we should have vitamins, proper vitamins at regular intervals.
Doctor, lifestyle modification and changes definitely play a role in acne treatment and prevention. Moving on, doctor, people have this habit of popping their pimples, and these all usually lead to pigmentation and scarring. So, can this be treated?
Acne should never be touched or popped. In fact, there is a term given to this, which is known as acne excori, in which the patients tend to rub their pimples, or they tend to break their pimples, thinking that the pimple will heal very fast. This is actually wrong. It should never be done. But whenever you see in acne, there are acne starts with comedones. And what is comedones? Comedones are basically blocks. They tend to block the opening of the hair follicle, and then the contents of the hair follicle cannot escape out on the surface of our skin. It tends to get collected inside, and this looks like a papule or a pustule. When we apply pressure on the skin, the hair follicle tends to break, and the contents of the hair follicle, which is oily debris and presence of microbes or microorganisms, it tends to leak inside. It goes into the dermis and incites an inflammatory response. When this inflammatory response takes place, it causes damage to the collagen tissue and the elastic tissue inside, and ultimately the healing takes with scar formation. And associated with scar formation, there is a lot of pigmentation. We see dark brown color uh, or sometimes light brown color, gray color, or bluish color. Pigmentation is seen depending on the level of the melanin, whereas this color is seen on the surface of the skin, which is termed as hyperpigmentation.
Doctor, can you help us with the treatments available for this post scarring and post pigmentation?
There are a lot of treatments which can be used to treat acne scars. Because scars once occur, it is not possible for it to go completely. Even after treatment, scars may reduce by 50 to 90%. And what are the treatments that we can use to treat scar? The fractional CO2 laser is the gold standard laser for taking care of acne scar. This has a downtime of 5 to 7 days. Those who are willing to take this downtime, fractional CO2 laser is the best. And those who don't want downtimes, then we can use MNRF, RBM glass laser can be used, RBM YAG laser can be used, and there are chemical peels which can be tried, and PRP can be tried, microderm abrasion. There are certain other subcision can be used, and there are many other minor procedures which can be tried to reduce the acne scars.
Doctor, can you share with our audience a generic routine which they can follow for acne prevention and treatment?
All patients should always use a gentle cleanser, a moisturizer, and a sunscreen in the morning every day. And at night, one can use a retinol-based cream can be used to prevent the skin from getting harder or thicker. This tends to exfoliate the skin and keeps the skin soft and supple. And at night also, one should use a moisturizer and a gentle cleanser to clean.
Doctor, with the increasing heat and the hot humid climate across India, fungal infections are becoming very common and the occurrences have become very frequent nowadays. What is the reason behind this?
Fungus tends to thrive on the hot, humid climate. As you can see in our country, there is a lot of overcrowding. Many people are living in one congested room. So it is very easy for fungus to get transmitted from one person to another person. And fungus can also get transmitted through formites. Now, what are formites? Use of napkins, towels, then combs, brushes, caps, footwear, which is very common in the house. People exchange all this, and it is from here that the infection can get transmitted from one person to another person, because fungal spores and the skin scales tend to thrive on these formites. Then fungus has become resistant nowadays to a lot of oral medications. So that is why we should avoid those drugs, because it will not work. Then there are combination creams which are available, and these combination creams contain steroids along with antifungals. These tend to increase the fungal infection, which is termed as recalcitrant dermatophytic infection or recalcitrant fungal infections. Many people have underlying medical problems like diabetes, obesity, which has to be treated. But otherwise, the fungal infections will not come under control.
Doctor, since you mentioned about fungal infections becoming resistant to treatments, fungal infections usually reoccur after treatment as well. What are the reasons behind this reoccurrences?
There is a misconception amongst people that when the itching gets less or when the erythema is gone, redness is gone, the fungal infection has disappeared and it is got cured. But this is wrong. Whenever we take treatment for fungal infections, even after all the symptoms have abated and subsided, we should continue at least oral medication for at least 2 weeks after a cure. Even the ointments that we are applying, it should be used at least 2 weeks after a cure. And the ointments which we are applying, it should be applied at least 2 centimeters beyond the affected area of our skin. This is known as the rule of 2, which should be followed rigorously. We should also treat the carrier sites. There are certain carrier sites from where the reinfection can occur, that is hair, nails, and in between the webs of our toes. This is where the fungus tends to hide, and then from where the infection can come back.
Doctor, this will definitely be one of the important conversations for our audience, which help them raise awareness about fungal infections and how can they prevent it. Moving on to hair fall, it is becoming one of the biggest concerns right now. So how can people identify that what is their hair fall due to?
There are many reasons why hair fall can occur. And nowadays people are extremely worried about the hair fall, and it is always better that if you see that excessive hair fall, go and meet your dermatologist. Because hair fall can be due to nutritional, it can be due to hormonal, it can be due to genetic conditions.
Doctor, since you mentioned about nutritional deficiency associated hair fall, can you elaborate on it?
Many people have lot of food fads. They go for dieting, do not eat properly or do not eat the right kind of food. So they tend to develop deficiencies, like maybe deficiency of vitamin B12, zinc, iron, proteins, and this is all can lead to hair loss. And when those have got nutritional deficiency, they usually feel very weak. They get tired very fast. Their nails become very brittle, and you will find the hair tends to break and it becomes very thin.
Hair fall is also associated with hormones and genetics. Doctor, can you please help us understand it?
Hair fall can also be associated with hormones, especially in the females, those who have PCOS. Along with hair fall, they tend to have oily skin, they tend to have acne. And these are the patients, they should visit the doctor and take proper treatment. Hypothyroidism, hyperthyroidism can also lead to hair loss. And finally, we also have genetic patterns in which there can be male pattern hair loss or female pattern hair loss, which are dependent on the androgens, which are the important androgens are important hormones for hair loss.
Hair fall is also associated with stress. So how does stress affects hair fall directly?
Yeah, hair fall is associated with stress. In fact, there's a very good term for this. This is known as telogen effluent. If you look at the hair growth is a cycle. We have anagen stage, which lasts for almost 2 to 3 years or even longer, and this is followed by the catagen stage, which is just for 15 days, and then the telogen stage, which lasts for 3 months. So it is when the hair reaches into the telogen stage, it tends to fall. When people are unwell or there is a stress of any kind, or they have undergone surgery or they have got underlying infections, then the hair growth stops in the anagen phase, and it quickly passes on to the telogen phase, and then it tends to fall off. Now whenever there is a stress, 2 to 4 months later, we find the hair begins to fall. This is termed as telogen effluent. And in telogen effluent, you will see there is diffuse hair loss. The hairline is intact. The parting of the hair is intact. The loss of hair in these areas is seen in androgenetic alopecia. But in case of telogen effluent, hair is not lost from these areas. It is only a diffuse hair loss. And after over a period of time of 2 to 4 months, this telogen effluent stops and the hair comes back.
So doctor, to treat hair fall, people use oils, home care remedies and viral DIY remedies available on the internet. So according to dermatology, what is actually effective for them?
Using oil will not give rise to stoppage of hair fall or hair growth. Oil only conditions our hair. It's only a conditioner, and it will make the hair soft and supple, but it is not going to do anything to hair growth. So we have to find out the cause of hair fall. So it is better to visit a dermatologist who will examine you and find out whether the hair loss is pattern hair loss due to hormones, that is a male pattern hair loss or female pattern hair loss. Is it alopecia areata, which is basically a disease in which there will be patches on the skin, and this is due to involvement of our immune system, which is responsible for hair loss and alopecia areata. Then hair loss can be nutritional, which we just covered earlier, and sometimes hair loss can be genetic. If, for example, somebody is born with mononectrics or trichorexis nodosa or certain loose anagen hair syndrome, these are the conditions with which they are born with, and they tend to lose hair.
So understanding the cause is the first step before jumping into the treatments. So what are the actual treatments available for hair fall?
Yeah, there are many treatments which are available for hair loss. Most important of them is minoxidil. Minoxidil really allows the hair to grow. It is a gold standard in hair loss. It can be used topically, and also it can be used as oral tablets. Apart from this, we tend to use vitamin D, then finasteride or dutasteride. These are anti-androgens which can be used orally or topically. Dutasteride can be used safely in females, not in males. Finasteride can be used both in males and females. Spironolactone is an anti-androgen which we use in females. Apart from this, there are certain proteins which are in hair serums containing procapil, capexel, redencel, which can be used. These are basically extracellular hair proteins which tend to make your hair follicle very strong. And then we also tend to use shampoos which will prevent perifollicular inflammation, so that this basically avoids dandruff formation or seborrheic dermatitis, and prevents infection in the surrounding area of the hair follicle and allow the hair to grow.
Doctor, that was really an insightful information. Moving on to sunscreens. With the increasing heat and the exposure to sun rays, do we need sunscreen every day and especially indoors?
There is a misconception that we are indoors, why do we need sunscreen? Especially in our high-rise buildings and in our tropical climate in India, we see a lot of sunlight which even comes into our house. So it is essential to use sunscreen because sun causes a lot of damage on our skin. It causes premature aging, and there are a lot of skin conditions such as actinic keratosis can occur, or our skin becomes very dry and scaly. And one looks really old prematurely if they're out in the sun for a very long time. So it is always beneficial to use sunscreen. And at least SPF of 30 should be used because this can stop 97% of the sunlight. SPF of 50 and more is essential, especially for those who are outdoors or those who take part in sports. And at least SPF 50 should be good. Nowadays we get sunscreens which are even more than SPF 50, SPF 75, SPF 80 and SPF 100 is also available. Now look at the light spectrum. Light spectrum will range from 290 nanometers and going beyond up to 400 and even beyond 400. So we have UVB light, UVA light, which is up to 290 to 400. Then after this we have got high energy visible light, which is the blue light, which comes from our digital sources like you're watching TV for a long time, you're using iPads or your computers. It is from here the blue light comes. So we must use a sunscreen which can take care of this blue light also. So we get iron compounds which are available, which are part of the sunscreen, which can take care of the blue light. And after the blue light, we have got infrared rays. So certain botanicals are available, which are part of the sunscreen, which can take care of the infrared rays also. So it is better to use these broad spectrum sunscreen rather than using only narrow spectrum sunscreen.
Doctor, we were definitely aware about SPF 30 and 50, but the other criteria of sunscreen has definitely increased the knowledge for us about the sunscreens. There are different types of sunscreen available: cream, matte, mineral base. So what is actually best for different skin types?
The mineral sunscreen consists of zinc oxide and titanium dioxide. These work very fast. Whenever they are applied on the skin, they immediately start working. And these are very useful because they do not irritate our skin. These are the pros, but what are the cons? The cons is that it tends to create a cast on our sunscreen, on our face. It leaves a white cast on the face, and this many people don't like. Like we have seen many sportsmen when they are out on the field, they tend to use these mineral sunscreen containing zinc oxide, and you see their face, if there's a white cast. So this our people do not want. So hence they tend to use chemical sunscreen. Chemical sunscreen will contain octocrylene or avobenzone. These are very light sunscreens. They can be used below makeup. These do not tend to irritate our skin. And even people with slightly oily skin or combination skin or dry skin, they can use this chemical sunscreen. But only thing is you have to bear that these sunscreens take time to act. It should be applied at least 15-20 minutes before going out in sunlight. Then we have got gel-based sunscreens, which can be used for those who have got acne, those who have got history of acne-form eruptions, or they tend to get acne. Those who have got oily skin, gel-based sunscreen will be very useful. And then those who are out in humid conditions, especially in Bombay where we have got humid conditions, gel-based sunscreens are more preferred. Then we have got matte-based sunscreen, which do not leave a shine on the surface of our skin. And those who have got oily skin, matte-based sunscreens are useful.
It is reassuring to know that there is not one size fit approach for sunscreen nowadays. Skin procedures like Botox, fillers, IV treatments are increasingly becoming popular nowadays. So, doctor, who are the ideal candidates for these procedures and are these treatments safe?
Well, these treatments are definitely safe, but whenever somebody comes to you for these procedures, we should have a good talk with the client. They should come and sit with the doctor, and you should question them, ask them what do they want and what are they looking at, because the expectations are very important. We should never start any of these procedures blindly. So have a good discussion, find out what the client needs, and then after that start them. Then we can select which procedures to use. Botox. Now, what is Botox? Botox is a neurotoxin. This can be only injected, and when injected into the muscle, it tends to relax our muscle, and they take care of dynamic wrinkles. Now, these dynamic wrinkles are like what we see on our face, are like forehead lines, frown lines, crow's feet on the sides of our face, and we see a lot of perioral rhytides around the mouth, and platysmal bands on the neck, and we see poppy chin. So these are the places where Botox can be used. Botox should always be used very carefully. The right amount of unit should be selected, and it has to be injected at the right place. Botox tends to work for 6 to 9 months, and after that it has to be repeated. It can be used in people, those who are around their late 20s or into their early 30s, and beyond that it can be used up till they are around the age of 60s to 70s. After that, Botox will really not work very well.
Doctor, can we understand more about lasers, PRP?
Lasers can be used to take care of pigmentation. We have Q-switch lasers. Q-switch lasers takes care of pigment. It gives a glow on the surface of our skin. Then the fine hair is targeted, and the skin pore size reduces. So this is how lasers help. They have to be repeated once in a month, and this is what we term as laser toning. And this can be used by anybody once they are beyond their 16 years, 17 years, 18 years. They can use this, and lasers can be used every month or even after 2-3 months. It can be used.
Doctor, what about PRP and fillers?
PRP is platelet-rich plasma. In PRP, we tend to collect collect blood from the patient, which is then spun, and out of that we tend to get serum. This serum is then collected into the syringes, and it is injected locally. It may be injected on the skin of the face, or it may be injected on the scalp for hair loss. Then the fillers are basically, they contain hyaluronic acid. These hyaluronic acid fillers, they restore volume loss. They are injected at certain areas of our face, for example, in the cheek or in the temporal area, maybe injected into the nasolabial folds or into the chin, and below the eyes, which we term as ear trough. So these are the sites where we inject these fillers so as to restore the volume loss.
Glutathione IV injections are increasingly used for skin lightening treatments currently now. So what does science say about this?
Well, glutathione injections were given earlier by many people, but nowadays there is a ban on giving IV glutathione. We should not give glutathione IV. Glutathione can be used orally. It is available. Tablets are available, or the sachets are available. I prefer using them. I do not use IV glutathione at all.
So, doctor, safety and precision definitely come before following the trends. Doctor, many people believe that aesthetic procedures create unnatural appearance. So, has modern aesthetics shifted towards more subtle and natural looking appearances?
Yes, you are absolutely correct. In the past, we used fillers which were quite thick, I would say, and these tended to give rise to a frozen appearance or overfilled appearance when they were injected. And many people also used a lot of units of Botox, which gave rise to mask-like faces. But nowadays, there is a trend to use hyaluronic fillers, which are very soft, and there are many varieties of fillers are available for depending on the area where we want to use a filler, we can select the right kind of filler. So it does not give a frozen appearance. It gives a refreshed look to a person. And the Botox that we use lesser amount of units so that they don't get mask-like faces, because everybody wants to emote. They want to show proper emotion. They don't want to hide their emotion. So, and they do not want others to know that they have used a filler or they have used Botox on the face. So nowadays that trend is to use lesser quantity of fillers and Botox and get a refreshed look.
Doctor, if you had any 3 simple skin habits which you would like to share with our audience to maintain healthy skin, what would that be?
Well, it is very simple. Look after your skin whenever you get up in the morning. Use a gentle cleanser. Use good moisturizer on your skin and always cover it up with a sunscreen. Sunscreen is of paramount importance. In the night when you're sleeping, wash your face with a gentle cleanser. Use a moisturizer. Use a mild retinoid-based cream, and sunscreen is definitely not required at night. But eat well, sleep well, have good nutrition, take your vitamins properly, and do not smoke and do not drink.
Thank you, Dr. Parasramani, for joining us today and helping us decode the science behind the healthy skin, busting the myths, giving us practical advices, and helping us understand that skin health is not just about perfection but also about protection.
Thank you very much. It was an excellent discussion and I enjoyed a lot.
Thank you, Doctor. Acne, scars, pigmentation, sunscreen, aesthetic procedures, hair fall. We covered it all. So next time, if you see any DIY remedy or any trend popping up on your screen, ask your dermatologist first before believing the algorithm. So thank you everyone for joining today and see you in the next episode. Until next time, stay informed, stay glowing, and we wish may your skin barrier be stronger than your Wi-Fi signal.